Hi guys, it's Patience, and I'd like to present to you my poster board on maternal mortality in Ghana. So, maternal mortality by the World Health Organization is defined as the death of a woman while pregnant or within 42 days of the termination of the pregnancy from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Sub-Saharan Africa, which is where Ghana is, has one of the most high rates of maternal mortality. 1 in 180 pregnant women is likely to die during childbirth in Sub-Saharan Africa. Ghana has currently, or as of 2017, has a maternal mortality rate of 308 per 100,000 live births. And this was from a number of 760 per 100,000 live birth from 1990 and to 2017. So there has been a significant decrease in maternal mortality. Risk factors include the mother's age, so teenagers are more likely to have complications due to their age or due to unplanned pregnancy. Low educational status. Individuals with low educational status are less likely to seek healthcare during pregnancy. Living in rural areas, individuals living in rural areas or the countryside have less access to healthcare as opposed to living in the urban area where there are big hospitals like the Kolibu Hospital, Confinancial Hospital. Those hospitals are usually equipped and staffed as opposed to the rural areas where you'd have to travel kilometers upon kilometers to get to a hospital that has some level of care. Poor socioeconomic status, and then cultural expectations of women. Some of the causes or issues related to maternal mortality is hemorrhaging, antenatal and postnatal hemorrhaging counts for the highest level of the cause of maternal mortality. Complications due to abortion. This is more prevalent in the low age individuals who are teenagers or have unplanned pregnancy, ectopic pregnancy, infections, hypertensive diseases like eclampsia, preeclampsia, and obstructive labor. So the interventions that was adopted, the global intervention was encouraged by the Millennium Development Goals, which was set by the World Health Organization to be undertaken by its member countries. So goal number 5 was to improve maternal health. So I believe it was 54 per 100,000 live births by 2015, and as we can see, as of 2017, that goal had not yet been met. As part of the Millennium Development Goals, Ghana adopted certain interventions locally to help reduce or to help promote maternal health. So there's nationwide free maternal care under the National Health Insurance scheme. So from prenatal, antenatal, and postnatal care up to 6 months of the child's life, the mother receives free health care. And this really appeals to the low-income families. There is also media, broadcast, and health center education on maternal care and the fact that it's free. A lot of people would still not go to healthcare facilities because they couldn't afford it, not knowing that the government has made it free for everyone. The media also increases education on family planning, just to help even with individuals. But I think it's limited. It's limited to married folks, so just to prevent them from unplanned pregnancies, or to prevent mothers who are at risk for mortality during their pregnancy, to prevent them from getting pregnant. And then there was the community-based health planning and services program, which was made a nationwide program. This program started from Navrongo in the upper East region, and it was made nationwide for all rural areas. The goal of this program was to provide healthcare services close to communities, and then to help empower women and vulnerable groups, and to improve health, provide a household and community interaction. What has the program done so far? It has really helped reduce maternal mortality. There is a slow but sure decline, as you can see below, since 2018. Since 2010, I believe. Education is raising awareness to issues of maternal health and family planning, and more women are seeking healthcare due to the fact that it's low cost and more accessible, closer to their community. Now, the challenges have been that there is, there is not adequate funding to provide training and supply equipment and medications for this program. There is not enough funding to put up more structures. A lot of the people complain that the traveling from their village to the village where the community-based health planning services compound or center is located is a far travel for them, and so there's more work needs to be done in that area. And then healthcare professionals are not really able to get into the community. Like, they're not really entering the community very well because they're having a hard time building rapport with the members of the community. There is also a strain on the healthcare system because there is only 3,217 healthcare facilities in Ghana for a population of over 29 million people. From the research, and an interview by some of the researchers One of the some of the statements by people interviewed was that there is no funding that comes from the government that is for training. Okay, so if you plan programs to implement on CHPS, it is very difficult to execute them. This is a healthcare professional who works under the CHPS. And then this next statement says, usually people walk long distances to come here, to come there, only to meet no one. When people come and they don't meet nurses, they will stop coming. This is a statement by one of the people in community addressing the issue of not having enough staff for the CHPS. This was a statement by a physician assistant, stated that the patient, a deceased patient, the patient needed oxygen and blood, which we did not readily have. In the process of giving normal saline, unfortunately, the client passed away before the national ambulance could arrive. The cause of death was severe anemia and hemorrhagic shock due to postpartum hemorrhage. So individuals are dying, really. Women are dying sometimes with their babies, and sometimes postpartum, because of things, interventions that could be made available to prevent their death. In a discussion of the whole poster board, I recommend that individuals with their support systems should be visited by healthcare professionals for education and assessment for high risk conditions. There should also be funding provided for high quality training and retraining of healthcare professionals, retraining of their skills and training for them to be able to learn how to build more rapport with the members of the community so that they can win their trust. There is also a need for healthcare professionals. Well, one of the things about Ghana is that midwives are at the forefront of labor and delivery. So more midwives should be trained to do C-sections in cases where C-sections ought to be done to save the lives of mother and baby, where there are usually no physician assistants or physicians available. This is a method that is being done in Ethiopia, and it has had tremendous success, and I believe it would have similar success for other sub-Saharan African countries too. Motorcycle ambulances should be provided to rural areas with poor roads to just help transport women and pregnant women to healthcare facilities. Sometimes just waiting for transport alone, it just increases the waiting time and makes a whole difference between survival and death. So this is my presentation of my poster board. I hope we have learned something about maternal mortality in Ghana, and I hope you enjoyed it. Okay, thank you.